how do you overcome state and federal laws about this? I mean, this special, and the reason I'm asking that question, this special, there were people who had prescription for medical marijuana. There were stores in California that they showed on this special where the people went in and picked out their product, but the stores and so on and so forth were always under the spotlight and hassled by local law and stuff. Where do you get your product, and how are you overcoming the stigma of unknowing as I'm listening to you talk?
Well, that's a good question. First of all, in the states, there are now 13 states. Actually, I think Jersey came on board yesterday. So there are 14 states where medical marijuana is legal on the state level. The states have the right to choose and regulate their own medicine. It's not a federal authority. The feds claim authority, or have claimed, based on interstate commerce, essentially. But because the states have the right, we wound up having conflicting laws. We have state laws that say, yes, we approve of medical marijuana, and we have federal laws that say, no, we don't. And it's the feds through the DEA that have been essentially harassing the medical marijuana community. When President Obama came on board, he promised to do something about that, and in fact he has. In that, he has now basically given directives that the federal government will not interfere in the states that are allowing medical marijuana. They will not interfere with the dispensaries as long as the people in those dispensaries and in the states are following state guidelines. So if they're legal within the state, the feds are going to accept that. Right now in California, for example, in L.A., there are more dispensaries than there are Starbucks. In Denver now, we have a higher per capita number of dispensaries in Denver than is true in Los Angeles. So it's just amazing. We have hundreds of them popping up, and the reason these things are popping up is because, unlike the federal government's position in general about marijuana being a dangerous, illegal drug, addictive drug, the people are now discovering the truth, and they're finding the benefits. People are getting off their long-term narcotic use. People are finding relief for things that they had no relief at all before, in many cases things like fibromyalgia. So the people are driving this thing. This is now becoming public medicine. And the research really at that level is being done by the people themselves, finding which strains work for them, finding what quantities they need. Because remember, they don't need protection from the FDA on a state level. So I happen to be in Colorado, which is one of the legal states, and this is our base of operations. And people have the authority, different ways to grow it legally within the state, so that we have suppliers that can provide us with organic quality marijuana. We're dealing with technical issues of cloning that are now available and genetic identification. Again, I'm a scientist. This is what I do. So we have what we need in place, and this is why we're going through the FDA, because the FDA has the authority to approve any medicine. The fact that it could be illegal on a DEA level will be overcome once something is approved by the FDA. And that's why we feel it's so essential, because without getting that FDA approval, the states that have not legalized medical marijuana, the patients in those states are either forced to suffer from their illnesses without the right medicine, or they're forced to becoming criminals. And this is outrageous in the land of the free.
I agree. I do agree. That I really want to applaud you on the research and what you're doing. The stigma of the ignorance of the pros of this particular drug and its uses. I think as time goes on and research proves, the possibilities and the goodness of what it can do for people, I think that you guys have a great future. Chris, did you have any other questions?
Yeah, sir. The only other thing I wanted to go into is you've covered a lot of the educational background. I think you've given the listeners exactly what was needed as far as putting them in that perspective to understanding where it came from, why it's needed, and those type of things. From the investor standpoint, I mean, is there anything that you would want to say to potential investors as far as investing in your company, especially since the growth of the states is happening and those type of things?
Well, we're ground level entry. There is a company in Britain, GW Pharmaceuticals, that has been in existence for a while. They've been the real pioneers. They have clinical trials going on in the United States now, so we know that we can kind of, in many respects, follow in their footsteps to get us through the FDA and to get us ultimately on the market. So I think that we are really in a revolutionary time right now. And again, because of our business model, legality will not impact in a negative way at all on what we're trying to do. We're going after those people who want to go to their doctor and get prescribed an FDA-approved medicine that they go to their pharmacy and get covered by health care. So this is a huge, huge market. The number of medicines that we can produce that will satisfy individuals' needs is really only limited by the investor community, because they're the ones that have to fund us to do this. So, if you have an interest in creating a healthy scenario for your own life and for your family and for your friends, become part of what we're trying to do here. I can tell you that a huge number of our investors are people who do use medical marijuana and know the importance of what we're trying to do. I mean, we're excited about it. They're excited about it. And the more the news gets out as to what we're trying to do, we know that the investment community is there. We see the responses every day with the people that we talk with and deal with. Our investors, are excited as we are.
Well, that's some amazing stuff. Well, sir, I've asked you many questions. Is there any particular question or area that I didn't ask you on that you'd like to elaborate on?
Well, no, I think we've done a good job of covering things here in an important educational manner. And I think we just have wonderful opportunities. And the people here at Cannabis Science, we work together in a concerted, open way. And I can tell you that we've got a great team here. We've got great projects underway. And, we're looking forward to moving into the future.
Well, Dr. Melamede, it was a pleasure having you on the show, and thank you for getting up so early and doing the interview. This is very educational, and I think a lot of people just learned a lot of stuff this morning, and you did your company very good justice with how you described it in simple forms and all that, and I appreciate you taking the time out, sir.
Well, I appreciate you giving me this opportunity, and thank you very much.
All right. Have a good day, sir.